All right, so in today's video, I'm going to share with you the common diagnoses that get confused with ADHD and why this is such a big deal. I mean, if someone thinks you have one diagnosis, but you really have another, the form of treatment that we get could be all wrong and just not effective, and it's not really helpful. So today, I wanted to share with you what those diagnoses are that get confused with ADHD and what we can do about it so that we make sure we get the right treatment. Now, just to preface, this is not clinical information or legal advice. This is simply made for educational purposes only. Also, this is going to be a webinar style video, no funny business, no fancy edits. We're going to dive right in. I'm going to share my notes with you. So let's actually just do that now. Here we go. All right, so real quick, let me just introduce myself. My name is Matt. I'm a therapist in private practice. I own a group practice called PRGRS Therapy, stylized PRGRS. We are located in New York City, but we are licensed in New York and able to serve clients throughout the state virtually. If you're interested, one of our specialties is ADHD therapy. So if you're interested in working with us or learning more about us, click the link down below. You can check out our website, set up a free consult, all that good stuff. But with that out of the way, let's start right here and talk about why ADHD gets confused. Now, the first thing I have to mention is that I'm going to be speaking largely from anecdotal experience as a therapist who's been working in New York City for over a decade. I've worked in large hospital systems in the outpatient psychiatry department. I've done private practice. I've worked in outpatient substance use facilities. So I have a pretty good clinical experience and I've seen a lot of different things. And so I wanted to share with you kind of anecdotal information, right? And things I see from as an experienced therapist rather than kind of reading research and reports and things, as helpful as that stuff can be. So the first thing is we have to answer, like, why does ADHD get confused with other diagnoses in the first place? Number one, I think this might be obvious, but ADHD is fairly complex, actually. And I think sometimes it's overly simplified, or people watch videos about it and, they think they understand it, but they really don't. ADHD is complex and it's often misunderstood. Just to give you an example, ADHD shows up in so many different ways. For example, it could show up, it could appear as forgetfulness. It could appear as increased, having emotion regulation difficulties, right? It can show up with rejection sensitivity, right? ADHD is something that affects every single facet of someone's life, and it can manifest in so many different ways. And so, if you think you understand ADHD, you might not, right? You want to do a lot of research, you want to understand it, you want to read about it. I find that I'm always learning something new, and just to kind of that's one of the reasons why I think that it's often misunderstood, and I think that it's overly simplified, and again, it's complex. So this is why it often gets confused. But now I'm repeating myself. Let's move on. Now, the other thing I want to share is that I'm going to share with you, and you can see it already, but there are a couple of diagnoses that largely get confused with ADHD. I want to let you know that just because they get confused doesn't mean they can't actually show up together, right? So that's called a comorbidity. So you can have ADHD and anxiety. You can have ADHD and bipolar disorder. Those things can happen together. All the more reason why we need a professional to help us kind of come up with diagnosis or to kind of identify what's going on, and particularly a provider who has seen a lot of stuff, right? Because you do need to have a depth of your understanding and a breadth of different issues out there, right? To kind of be able to differentiate between, what's what, and, what might be comorbid, what might be one and not the other. And so again, this just gets more complex. So a professional assessment is absolutely crucial and critical. So let's now this is not a surprise, you've seen it here. I want to walk you through a couple of the common diagnoses that get confused and just a little bit about why, again, from anecdotal experience. All right. So one thing I see often is that people with ADHD will sometimes get misdiagnosed with bipolar disorder, right? And now there's two types of bipolar, you bipolar 1, bipolar 2. It can get more complex than that. But simply put, we have bipolar 1, we've got bipolar 2. I'm not going to get into the nuances of bipolar disorder, but one of the reasons why you'll see people confusing it is you'll see elevated mood, right? It's a common one. You'll see people with bipolar. I think stereotypically people will think about this as kind of elevated mood or mania or something like that, right? But I do think, you'll see kind of these mood swings. You'll see episodes of, elevated moods, and sometimes it's not elevated. It could also be a lower mood, right? And we might even see what people would kind of describe as kind of these hyper focus episodes or these kind of fixations, right? And so you'll have a lot of commonality in some of the manifestation of bipolar and ADHD. So for example, people with ADHD, also have, I wouldn't use the term mood swing, but you'll see people with ADHD will have rapid shifts in mood sometimes, right? You'll also see sometimes this, what we would, hyper focus is what people would call it, right? And so on the surface, these two things might look similar. And a provider who's not experienced and isn't able to differentiate between the two, right, might just quickly say, oh, well, that's bipolar disorder, right? Or, oh, that's, bipolar 1 or 2. And maybe it's not. It might be ADHD. There are critical differences in the presentation of these things, right? But you have to know about them, right? And so I often see a confusion here. So someone will have the label or the diagnosis of bipolar, when really it's ADHD that explains it much better. And the treatment for bipolar and ADHD is very different as well. Okay, so that's bipolar disorder, kind of a simple understanding of why it might get confused. Okay, number 2, borderline personality disorder. So a lot of people will kind of associate borderline personality disorder with emotion regulation difficulties. And like I said before, people with ADHD also have challenges regulating emotions, right? And so on the surface, again, if you have someone having a challenging time dealing with emotion regulation and you're not an experienced provider, some people go straight to borderline, right? Or something else. So I often see this as the main reason for the confusion, right? But again, two very different things, and two different types of treatment, essentially. So the other one that we can actually add, and we're gonna talk about this later, is kind of this rejection sensitivity. And there's a whole thing about rejection sensitivity and ADHD. But again, you'll see people associating borderline with rejection sensitivity, right? Or kind of having sensitivity to rejection. And although this may be true to some degree, people with ADHD also deal with that. But again, two different diagnoses. So these are some of the reasons I see the confusion happening when it comes to borderline personality disorder and ADHD. We have PTSD. So I think PTSD is obviously very complex, but why is there confusion? I often see, again, kind of emotion regulation challenges, right? And again, you'll notice kind of this common theme of emotion regulation kind of coming up amongst all these different diagnoses, which makes sense, right? I think a lot of diagnoses kind of have this, kind of one of the criteria is, usually has to deal with kind of emotion regulation and things like that. So again, you might see someone with ADHD, again, dealing with emotion regulation. And then, depending on what is shared or kind of the person's history, you might have a provider label this as, PTSD, when it's really ADHD. Also, there's research that shows that people with ADHD are more likely to experience trauma, actually. Which is another reason why this might get confused. And again, it's not always confusion one or the other, but maybe it's both, right? But someone is only focusing on PTSD when there's also ADHD, which can be not great. So that's PTSD. And then these two here, anxiety and depression. So you're going to see a lot of comorbidity. So a lot of people with ADHD also have anxiety, and a lot of people with ADHD also have depression. The comorbidity rates are pretty high, actually. But so again, I think the thing is, when someone doesn't have that much experience, they might write off what the person's experiencing just simply as anxiety. So let me just give you an example. So let's just say, for example, someone with ADHD struggles with procrastination, right? Which leads to handing in work late, and then kind of having repercussions for that. They might come in and talk about the anxiety they have around work, right? And so someone might simply label this as, oh, it's anxiety, or, generalized anxiety, something like that, when really that's coming from the issue from ADHD, right? Procrastination or the executive function challenge there. That's a very, very simple example, but you do see this happening to people, right? Or maybe it's both, right? But we cannot just label ADHD as anxiety. It's not going to be, we need to get the proper treatment for both of these things if they're there. And the same thing goes with depression, right? So if you go back to that example, again, someone deals with, they're feeling low and down. It may be because there's depression there, and that's the explanation, but maybe it's because of all the quote unquote failures that have occurred because of ADHD, and they've forgotten assignments, or they've lost relationships because of their executive function issues, and so now they're feeling depressed about it. So you can often have depression confused with ADHD as well. And again, high comorbidity between anxiety, or between ADHD and depression. Now, I know I went through this video kind of quickly. I really wanted this to be straightforward, and I wanted this to be kind of speaking from my own anecdotal experience as a therapist. I really want this video to be empowering. So maybe this triggers something for you, or maybe this is something you can then take to a provider. But hopefully this gives you some more information and educated you on something you might not have been aware of before. And at the end of the day, I hope this video was helpful for you. All right. Again, if you're interested in working with our practice or knowing more about it, there's a link down below. Other than that, have a great rest of your day. We'll see you soon.